Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Welcome, everybody. We are back again as we continue to talk about mental health awareness. As you guys have experienced all month long, we've had special guests joining us on this podcast to take a minute to reflect on the importance of understanding the mental health and how we can apply it to ourselves. So joining us today, we're excited to have not only one of our Keiser University own alumni, but also one of our Reiki practitioners. And we don't get to talk about that too often. So joining us is Dr. Alexandra Garcia, all the way from Puerto Rico, where she is also a professor at the University of the Sacred Heart. Thank you so much, Dr. Garcia, for joining us today.
Thank you for having me. This is a really special occasion and very exciting for me. So I'm glad to be here.
Oh, thank you. And I hope you don't mind. I have a whole bunch of questions and I really kind of want to get right into them because today we're talking a lot about self-care and tools and techniques that we can all do ourselves. And again, that's with the understanding, just like some of our other podcasts that we've had, we need to take a minute that when we talk about mental health, we do have a few disclaimers that we got to take a look at. When it comes to tools and techniques, and you'll hear it from Dr. Garcia herself, it's always important to check with a professional first before you use any of those tools or techniques to make sure that you're doing so safely, that you don't have an existing condition that could possibly cause additional harm in any of these practices. And again, you'll hear that from Dr. Garcia too. But we just want to make sure that as we really take a look at mental health, that we're doing so appropriately and properly and giving it the proper importance. And it can be a great tool. A lot of the stuff you will hear about today are fabulous opportunities that we all can take advantage of, but when they're done so safely and properly. So getting right into that, Dr. Garcia, what exactly does self-care mean?
I think there are so many definitions right now about self-care. And the first thing that usually comes to mind is usually something complicated like a spa day or taking the day off or, a bunch of other things that are really great and really comforting, but are not always necessarily doable, especially with our busy lives. We have families, we have homes, we have jobs. Students have their additional academic responsibilities, so it's difficult to take time for self-care. So self-care would be anything that engages you directly and forces you to be in the moment, to be aware of your needs, and to take care of those first. And again, it's important because society teaches us to a degree that if you're putting yourself first, you're being selfish. Well, if you don't take care of yourself, you really can't fulfill your commitments. So, you're back where you started. So again, self-care is something that we should engage in on a daily basis, and it doesn't have to be complicated. In fact, the best techniques are very simple and don't take more than a few minutes.
What are some of those techniques or practices that we could implement on a regular basis?
Well, the first one I would say is diaphragmatic breathing. Again, check with your practitioner to make sure it is safe for you to do so. And this I learned from a clinical psychologist. The difference in this type of breath work is that you're not counting necessarily, you are breathing like a baby. So if you watch a baby breathe, they expand their abdomen completely, their entire diaphragm expands, and they just exhale very slowly. So you go breathe until your stomach expands, your lungs, your chest, and then exhale slowly. And the good part about this is you're doing it through your nose, so it's not necessarily visible to anyone else, but you're feeling the effects. And this is particularly useful when you are in a difficult situation, or you can't move from where you are, or you can't really show emotion or express yourself, like maybe you are working with a difficult client or having a difficult day. Pause, take those breaths, and it will help you regulate.
Are there any other practices? I personally practice the breathing techniques myself, so I am very familiar with quite a few of those that my doctor has said it's definitely something that I can put into motion when I'm having those moments. Are there other techniques that, aside from breathing, that someone may be recommended to try or could potentially try?
Absolutely. Meditation is definitely something that is recommendable, and there are many ways to do it. Most people, when you speak of meditation, what comes to mind is the cushion, the yoga pose, the the background with the flowers, the Disney background, and that's just not realistic. So you don't need an hour to meditate, and you don't need to stare into a candle flame. If it helps you, fine. But there are many ways to practice meditation. So, for example, if you happen to be a spiritual person and you have a religious practice, you might just focus on a particular prayer or something that is important, sacred, or special to you. And what you're doing is interrupting um, you're interrupting your thoughts, your thought patterns. And this is particularly important when you're kind of tending towards a spiral. Those disruptive thoughts, you want to stop them in their tracks before they lead you down an unhealthy path. So you can't really control your thoughts. So meditation, again, is not about controlling your thoughts. It's about disrupting them so they don't get to a place where they can control your reactions. So, for example, something that I like to do is crafting. Anything that is a repetitive motion will get you into a meditative state. One thing that has become very popular is like walking meditation. So if you're taking a daily walk, even if it's just 10 minutes or you're going around your house because it's raining outside, focus on the movement. So the moment you focus, your brain moves away from all of those intrusive thoughts and it redirects. And that's what you want. So it doesn't take a whole lot of time. It doesn't take any special environment or special instruments. Use what you have to, disrupt the flow of your thoughts.
One type of practice I commonly hear about is journaling. So is that something as well? Like, maybe somebody has limitations on activities. Would journaling work? I know you mentioned crafting, so I think it's kind of along the same lines.
Yes, journaling can be very healing. It's one of the things that is recommended for people who are going through trauma, because the moment that you put it down on paper, you are, in a sense, externalizing it, but in a non-harmful way. Because you're not taking it out on anything or anyone, you are not engaging in self-harm. You are putting it on paper, and it looks very different when you write it down. And it helps you to process certain things that might not at first be obvious. The same thing happens with art therapy. What I love most about art therapy is that sometimes you don't have words for what you're feeling or what you're going through. You're feeling a certain way. You know that you're feeling that way, just don't know why or how to express it. So you can engage in any form of art that is useful or comfortable or pleasant to you. The important thing is that it should be a pleasant activity. And that's a great way to express yourself. And you can you can forget it for a while and then come back to it later, and you can see your progress.
And those all sound great. And I think a lot of us have probably heard of one, if not all of these different things all the time. But why? Why any of these or why are these the ones that are recommended, or just why in general are these tools always provided?
Yeah, why do they work? Or why should we even bother doing?
Right.
Well, in the case breath work, which is one of the most popular and the first ones that probably even practitioners will tell you, is that you're regulating your sympathetic nervous system. So you have your autonomic nervous system, your parasympathetic, and your sympathetic. So the autonomic takes care of your organs, the things that you do normally, how your body functions without actually having to think about it. Your parasympathetic mostly goes with glands and the functions of those glands. But your sympathetic nervous system is where your fight or flight responses live. That is your survival mechanisms. So breathing, the first thing that is altered when you're in a difficult situation or in a survival, you go into survival mode. One of the first things that will be altered is your breath, because your body is preparing to respond to the environment. So it's about, again, survival. So what you're doing is by regulating your breath, you are calming your amygdala, which is, the center for that fight or flight. And you are telling your brain, good job, but, hey, we're breathing. It's good. We're alive. Everything's fine, and we can control it. So what this does is it brings down those responses so that you can think more clearly, and definitely that'll help you to respond better to your situation rather than reacting in an instinctive manner. So that's why breath work is so important to wellness. And it's something that you can practice anywhere, anytime. So we're talking about journaling. Again, as I said, it's a way to express yourself. And there are different ways to journal. Some people do it through poetry. Some people are not comfortable putting their thoughts on paper. So again, that's where artwork comes in. So you can have a journal with drawings, even if you can't draw to save your life. You could just doodle. Coloring. So that's why there are a lot of adult coloring books that are coming out, because again, it makes you focus on a single thing. So while you are focused on this, I think it's been proven that multitasking, your brain can do several things at once, but it can't do them well, all at the same time. So while you are choosing to focus on one, you are again redirecting. You're telling your brain, I want you to do this, and leave off with everything else. So everything else kind of just fades into the background. It's not that it disappears, but it kind of fades. And that gives you a chance to regroup so that, again, you can respond more adequately, more in control, and less in terms of an instinctual reaction.
Okay, it's starting to kind of make, more sense, because I don't think often enough we hear that, like, why. I think it's, you should do this. Okay, but why? But how do we incorporate this, or even just prioritize self-care in our daily schedule? I mean, you mentioned before, like, we're busy individuals, students, families, jobs. I mean, it all kind of adds up.
Right. So here, one of my favorite techniques is called stacking your hacks. So I take several things and you incorporate them into your routine. And because they don't have to take very long, it's easier to do, because when you have to go out of your way to create a new habit, it's not impossible, but it's a little bit harder and it'll take you more time, and not everyone has that time. So use the time that you have in a manner that is more helpful to yourself. So for example, you already have a routine in the morning. So you have your hygiene practices. You brush your teeth, you wash your face, you comb your hair, you get dressed. You can use that time to focus for meditation. Focus on how you would like to experience your day, instead of thinking, okay, I have a really important meeting today and I'm super nervous, or I have to get the kids here, and we are already anticipating ourselves and creating anxiety before anything happens. So if you take that time to mentally prepare, you can just do breath work as you dress, or as you make your breakfast, even while you're doing your dishes. So one thing I love to do is, just on my window ledge, I like to have, potted flowers or herbs. And while I'm doing the dishes, I can just focus on something beautiful. If you don't have a window ledge, you can hang a nice picture or a drawing from one of your kids that makes you happy or smiling when you see it, and it makes you feel better. The importance is that it brings you joy. And we're going to talk about this in just a little bit, which is what I call intentional joy. That's a whole other topic. Again, going back to integrating, what I like to do is on my lunch break, I work obviously on a very beautiful campus. So I like to take that time, and once I've had my lunch, I sit down and crochet on a bench under a beautiful tree and put in my headset and listen to guided meditations. So there are plenty of those, even There are apps, there are lots of apps. And if you're into guided meditations, there are plenty on YouTube that are completely free. There are short ones, there are long ones, there are, just sounds, sounds of nature, whatever works for you, whatever is soothing is what's important. So I'm taking a time that I already have and turning it into that little special time for myself. So when I go back into work, my mind is more relaxed and I'm better able to focus on the tasks at hand.
You kind of lead me to asking like another question that I was thinking about asking, and I wasn't sure if I was going to ask you or not, but you mentioned YouTube and looking stuff up. So now I really kind of want to ask you about technology. So is technology friend or foe when it comes to supporting self-care practices?
Well, it depends how you use it. Like right now, there's a big debate around ChatGPT. Is it the friend or the foe of academia? Well, it depends if you're using it as a tool to help you improve, or if you're using it as a crutch to not do the work. It's kind of the same thing. So there are apps that can help you focus if you have trouble focusing. So one of them is I have on my own phone, it's sounds. And it's just sounds of nature, and you can combine 2 or 3 different sounds like wind and rain, or a thunderstorm, or a river, whatever is soothing for you. And that can help you kind of just relax, because you don't always have access to nature. If you're in the office, you can't necessarily go outside and take a walk and just leave all your responsibilities aside. Again, with the guided meditations, if it's something that soothes you and helps you to focus better, you're using it as a tool, not as a substitute for the work you need to do.
So how do we get to where, or how do we find the right self-care technique that would work for us? I mean, obviously it's gonna, like you kind of mentioned before, different things work for different people. How do we get there? How do we get to that point where we're finding what is working?
So everyone will tell you that it's trial and error, and yes, there's a bit of truth to that. But I would say what you don't hear a lot is go back to your inner child. So what things did you do as a child to self-soothe? Did you like to color? Did you like to draw? Did you like to listen to music? Did you like to skip rope or ride your bike? So take those things and make them grow up with you. What works for you? What, if you think of it with nostalgia and it makes you feel good. So you're thinking with nostalgia like, oh, I used to love coloring. Well, maybe that's what you need to be doing. Get a coloring book, or if you don't have a coloring book, get a piece of paper and doodle. So play, introducing play into your life. And again, not everyone plays in the same manner. You might like, kind of like to play Tetris on your phone, and that kind of distracts your mind. You might like to do puzzles. For some people, it's cooking and baking. Anything that is creative is breaking away from anything destructive, because again, you are making something good or making something beautiful, and you're not worried about the results. You're focused on the enjoyment of the process. So again, what we're working on is breaking the cycle of intrusive thoughts.
So a lot of this that we've talked about so far, and I have so many more questions, and I don't know that we have enough time today to go through all of them. A lot of this is talking about planning, right? We're planning ahead. We're getting ahead of it. We're talking to somebody who can help us figure out what that method is going to work, and we're trying to find that way to incorporate it, because it's like you said, it's not selfishness. It's something that we really need to do. But what about when you're in a moment, and whatever that moment is defined by you? Maybe, you're somebody who unfortunately, was triggered by a certain situation. Maybe you're in a moment where you're feeling overwhelmed. We get, some of our doctoral students, they hit that dissertation phase of their program, and they're really stressing out. And you can't always plan for those moments. So how do we handle those moments?
Well, there's a few things you can do. The ideal is to create kind of like a list or a plan when you are cool-headed and calm before these things happen. It's not always something that you can do, but if you can, that would be best. One of one of my favorite techniques is an anchor point. So the anchor is a friend or a trusted person that you know has your best interests at heart, who is not going to judge you. Not everyone has the advantage of this. Perhaps it's a therapist or another healthcare practitioner. So the point is to have someone that can help bring you back to reality when you're overwhelmed. So it doesn't have to be a long conversation, just I have my anchor that I will call her and say, I need you to anchor me. And she will give me a talk down really quickly, like, down into reality, into the moment. And it's actually very helpful. Another one that I call is the point of light. Sometimes you don't need a talk down. Sometimes you're looking at that long tunnel and you just need to know that there's light ahead so that you can continue moving forward. So that can be another person, or this can be an object, something that brings you joy. Maybe you have your baby blanket, or, it sounds silly, like a stuffed animal or a drawing of a card someone special wrote to you, something that just brings you joy, that makes you pause and remember that there is beauty in the world, that there are good things have happened, and good things will happen again, no matter how difficult the moment you're going through. And that can help, again, redirect you to focusing instead of on the difficulties of the moment or the challenges or the trauma, helps you focus on something beautiful that, again, relaxes you and allows you to move forward. So another thing I like to do, and that's called the annoyment. So
Okay.
yes, intrusive. Those intrusive thoughts have a voice, and it's usually mixed with your inner voice. So you want to change that. You want to imagine the voice of the most annoying voice you can think of. It may be of an actual person, a person who caused you trauma in the past, or someone that in the present you would not give the time of day to. You would not listen to them because you know they're not going to give you good advice. So that voice, you want to assign it to your intrusive thoughts. So the moment you hear that voice, you're going to say, no, I'm not listening to this. This is not leading me anywhere, and it's easier to ignore.
What about, and again, this is more so for the people, I'd like to say, just because I've dealt with anxiety myself, anxiety has no rhyme or reason sometimes, or at least it feels that way. What about those moments where, for instance, and we kind of talked about this before we got started recording this episode, you're alone in a car at night by yourself. What about in those moments, bringing it into that, where they come, if you will, more so out of the blue?
Well, as we were talking earlier, it's like, again, this is no substitute for proper care. So if your battery dies in a parking lot at night and you're alone, you want to jump that battery just to get your car started so you can get yourself to a safe place and then deal with the entire issue. It's not something that you can ignore because your car is going to die out again and you're not going to know what happened. So it's better to just take care of this moment and then move forward into a healthier situation. So again, you want to try like breath work, that breath regulation that will help you calm your sympathetic nervous system, that will tell your brain, we are alive, we are okay, and we're going to deal with this. And enter resilience. And resilience is not about everything is okay, because sometimes it isn't okay, and it isn't necessarily going to be okay. It's about knowing that you will be okay because you've been through worse before, and you have in yourself the strength to continue going, even when you feel like you can't.
Okay. Um, we didn't really touch on mindfulness. So let's just quickly define mindfulness, because it's going to lead me into the next couple of things that I want to ask you and ask you about, if you will. What is mindfulness?
So mindfulness is about self-awareness. It's about being present in the moment, because our minds race like a million miles a minute, and a lot of times we don't enjoy the present, and we miss the forest for the trees. So celebrating the small things, it does sound pretty cliche, but I promise it isn't. So, and it says this is particularly true for our graduate students. It's like, great, I got an A on this test or on this project, and your mind is already going to the next one and worrying about how you're going to do in this, or how you're going to do in the next course, or what you're going to do for your dissertation. So you're already stressing your system by implying that you don't have what it takes to move forward. You don't want to do that because, again, you are spiraling in a direction that is not healthy. It's going to make you question your capacity, your self-efficacy, your self-worth, your self-esteem. So before going there, let's go back to self-awareness. What's going on in the present, and how do I respond to this? So, and enter what I was talking about earlier about intentional joy. Joy needs to be intentional. And why? So joy is not part of our survival instincts. So the brain considers it a waste of time. It's like, wait a minute, we have more important things to do. We've got surviving to do here. There's no time for this. No, on the contrary, you need to be intentional about experiencing joy, even if it's just the little things, because it will give your mind a rest and strengthen your mental health.
So I ask about those two things because I really want you to tell us a little bit about Reiki, since you are a practitioner of it. So what is Reiki for those who haven't heard about it, or maybe they have, but I got no clue what it is.
Well, Reiki, in a nutshell, is about energy healing. So if you want to put it in more simple terms, it would be about entering into universal consciousness or universal flow. However you want to define this, if you're a spiritual person, it would be like communing with whatever is holy to you, and losing yourself, not to the point of losing your identity, but rather entering into this flow and becoming a conduit for something that is greater than yourself. So again, you need to be aware, you need to be present in the moment, and you need to redirect those intrusive thoughts by, again, bringing yourself to the present, bringing yourself to consciousness.
How do we practice Reiki? I mean, obviously under supervision of a practitioner like yourself, but how could we incorporate that if that's something that might work for us?
That's a good question. There are things I obviously can't share because they are, kind of tied to practitioners. But again, it would be through awareness, mindfulness, and meditation. So bring yourself to the moment, bring yourself into focus, into self-awareness, into self-reflection and self-regulation, because that's, in the end, that's really what it's about. It's self-regulation. And understand that there is always something bigger than yourself, whether you call it the universe, your higher consciousness, God. That depends on your particular values and philosophy of life. There's no wrong way to look at it. And just focus on healing, focus on what is good, because the universe is immense. There is so much that's good and beautiful out there, and no matter how many things happen to us, how many negative things are going around in our particular environment, it's good to look at the bigger picture. So there's always something bigger, there's always something greater, and just sitting in the presence of that will help kind of not just bring into focus, but help you prioritize and contextualize whatever circumstance you're going through at the moment.
I really love the sentiment of incorporating the joy and then looking for that greater good. Are there any other tips or suggestions you have for anyone listening about the tools and techniques?
Well, I would finish with the 5 Reiki principles. They are very good rules to live by, and a reminder to focus on the moment and focus on the good. Now, I'm not talking about toxic positivity and ignoring what's wrong, but it's easy to get overwhelmed with certain circumstances and, whatever's going on in the environment, with the world at large. You combine that with your own personal challenges, and it's easy to get overwhelmed and to spiral. So again, these principles will bring you back to anchoring yourself in the moment and self-soothing. So the first one says, just for today, I will not worry. Just for today, I will not be angry. Just for today, I will do my work honestly. Just for today, I will give thanks for my many blessings. Just for today, I will be kind to my neighbor and every living thing. So I think
those are fabulous.
They're basic universal values.
Well, Dr. Garcia, we really want to thank you for taking the time this month as we look at Mental Health Awareness Month and talking to us about these tools and techniques. Hopefully those of you that are listening, if you heard something that sounded interesting, again, talk to a practitioner, talk to a counselor, talk to that professional to help guide you in the right place. And if Reiki sounds like something that might really work for you, make sure you find a practitioner like Dr. Garcia that can lead you through these practices properly, because while they all sound good, if you aren't doing it properly and under proper guided professional oversight, if you will, it can actually do some harm. So Dr. Garcia, thank you for joining us. And if you guys enjoyed what we talked about today, be sure to like, share, and stay in touch with us the rest of this month as we do continue to explore mental health.
Thank you for having me. It was wonderful being here. I really appreciate it. So thank you again.
Thank you.
Thank you for journeying with us today on Keiser Voices, the story of success. As we close this chapter, remember, every story has its next page.